Choosing the right size is very patient specific and patient dependent. So we take a lot of things into consideration. Number one, what is their current shape that they have right now? Number two, what shape do they want to keep or change into? And there's a few different choices. And then number three, kind of just like breast augmentation, they can tell me how much larger they want to go, and we can try to assess how many cc's that translates into. I do think that their height is very important. So if somebody is 5'1", a Brazilian butt lift is gonna change the shape of their body a lot differently than if somebody's 6 feet tall. You know, so the more petite the person is, the more exaggerated the BBL will look if we go for a larger change. There's a big difference between a fat transfer Brazilian butt lift and, let's say, a buttocks implant. A buttocks implant is where we actually make it a cut in the buttocks and actually put a firm silicone implant underneath the muscle, the gluteus muscle, to create the shape, the new shape. It's a much more complex procedure and has a lot higher complication rate. And in general, it's our least preferred surgery of the two. There's certain situations where a Brazilian butt lift may not be possible, and that's where the recommendation of the butt implants come in. So if a patient is too thin or doesn't have enough fat to transfer to the buttocks, that is one of the situations where we would recommend the buttock implant surgery. However, in general, if a patient does have enough fat cells, we would much more likely recommend the Brazilian butt lift. My technique is a little different than other surgeons simply because I do many different types of Brazilian butt lifts. We also accommodate patients who want different shapes. If they want a round shape, if they want an upside down heart shape, if they want a bubble butt, if they want to bring in photos of Kim Kardashian or Jennifer Lopez, we'll generally try to accommodate that, and also keeping safety in mind as well. Over the last few months, there's been a lot of negative press about Brazilian butt lifts, and keeping the fat in a certain level of the buttocks and not going too deep with it is very important in minimizing the complications and the risks from the procedure. There are differences between also female and male Brazilian butt lifts. In general, females tend to have wider looking hips and shapes, so we can reshape the buttocks in that regard. Male Brazilian butt lifts are generally more centralized, more round, and much less fat put in the outer hips. Brazilian butt lift generally takes about 2 to 3 hours depending on how many areas of liposuction we have to do. The process to have a Brazilian butt lift generally takes several weeks. Consultation, then we have a pre-op appointment, we have the procedure, and then there's a several-week recovery. But from the time of the consultation to the surgery generally takes about 1 to 2 months. A Brazilian butt lift has its share of post-operative pain just like any other surgery. I think soreness is probably the most common feeling people have, almost like a muscular soreness in the buttocks. And it's really just when they sit on their buttocks where they'll feel the most discomfort. But just like any other surgery, we do offer pain pills and certain types of comfort measures to make the pain as easy as possible. A Brazilian butt lift has very, very minimal scars. Essentially, it's just the entry points from where we insert the fat cells. A typical scar for a Brazilian butt lift is smaller than a staple punch. Most people after a Brazilian butt lift feel like they can go back to work within a week, but in general it takes about 3 to 4 weeks to feel back to normal. A typical Brazilian butt lift procedure ranges anywhere from about $8,000 to $10,000. All of our cosmetic surgeries can be financed. We have several financing options. Unfortunately, it is a cosmetic procedure, so it's not covered under most insurances.